Hi, it's Shirley Gutkowski, your host for the Spot for Health and the owner of Primal Air, OMT, and breathing retraining. And I'm here again today to talk with a chiropractor about chiropractic health in Sun Prairie and where you can go for your chiropractic care. Today we have Dr. Scott, and I'm going to let him say his own last name because it's spelled, well, we'll find out in a second. So he grew up planning to be a chiropractor. That was pretty fun. And it was a specific experience that opened his eyes to a possibility of it being a career. He went to see his own chiropractor as a kid without even mentioning that he'd had swimmer's ear. And when the chiropractor realized that he had an ear infection, he asked Scott, hey, what about this ear infection? And Scott was like, well, what about it? So the chiropractor just did a little manipulation, everything drained out of his ear, and presto changeo, he realized he could be a chiropractor as a career choice. Welcome to Spot for Health.
Oh, well, thank you very much for having me.
Say your last name.
Sure. My last name is Nigbor.
Nigbor. Okay.
Yeah.
It's almost neighbor, but not quite.
That's right. That's why I'll go. We just go with Dr. Scott. We just make it easy. So.
Well, I kind of am in the same boat. When people hear ski at the end of a name, they usually just like panic. So
Yeah, absolutely.
So we're going to talk a little bit about today about the nervous system and how chiropractic works with the nervous system in general. So where do you think we should start with that?
Sure. So as a chiropractor, everything is with the nervous system and restoring function. Sorry, I guess I'm blanking here all of a sudden.
It's all good. So you don't necessarily work with just, back pain. That's not the real reason that you go to or it might be a starting place for a chiropractor, but as a patient, you could go to see a chiropractor for swimmer's ear or for high blood pressure or for some other reason. So there's some real specific other things that can be helped by just managing the nervous system. I hate to say the nervous system because it sounds so highfalutin, but it's the electrical system of your whole body.
Correct. And so off that point, so as a chiropractor, we don't actually treat ear infections. We don't treat colic. We don't treat ADHD, autism, and all these other things that typically some people will come to a chiropractor asking for. As a chiropractor, we work with a condition called a subluxation, which is a misalignment of the spine that causes neurological interference that blocks the brain's-body's connection. At every single level of our spine, there's a nerve root that innervates a certain tissue, organ, gland, or cell. And so if you have a subluxation, it blocks the brain's ability to talk to those specific tissues, which leads to dysfunction. Research actually shows us that the pressure from the weight of a dime alone resting on a nerve will decrease a neural impulse by 60%. So I can't measure how much, how much pressure is sitting on a nerve, but either way, how happy would you be with your husband if you left him a message and he missed 60% of it? Not very happy.
I wouldn't be happy, and I can tell you right now, I'm not happy when that happens.
Well, no, absolutely. But just think about how happy are your organs, how happy are the different parts of your body if it's not perceiving every message or neurological input that it's actually supposed to be receiving.
So you have this idea of this perfect storm that things kind of accumulate into a situation that needs intervention.
Correct.
Is that kind of the generic-ish way to say it?
Sure. So really the perfect storm, what it is it's just the continuous onslaught of stress that bombards our system and bombards our body that eventually we have to coordinate new functions. And so when we're looking at things such as, let's just go through some statistics. The new normal right now for our kids and families is 1 in 10 kids has asthma. 1 in 7 kids has ADHD, and the most common drug that's actually prescribed to these kids is it's a class 2 controlled substance. It's the same classification as cocaine. Mental illnesses, 1 in 5. Autism is on the rise at 1 in 45, and and the stats are only getting worse and worse as the years go on. And so for me in my office, when we look at things, we look at the news and we see all this stuff about Zika or Ebola, and they're terrible diseases, but it's affecting 0.00000% of our
Yes.
population.
Right.
Versus there's some massive things that are going on out there that, and I know parents are out there seeking the answers for it. And so, as a doctor literally means teacher, and I take that really to heart. I spend a lot of time trying to educate patients about what is going on with your health and how we can try to make lifestyle changes so that your life can get, improve and get better.
But a pill is easier.
A pill is always easier, but is it correcting the problem, or is it just masking the symptoms?
And then you need another pill.
That's right.
And then you need another pill.
It's always funny to listen to the medication commercials for stuff
Oh my
where
God, my husband just cracks up.
yeah, it's funny with it. I mean, again, there's always a time and place for medicine. It's not my place to bash it. There's always a time and a need for those things. Our medical community is the best in the world at the acute situations. But when it comes to more chronic conditions and illnesses that people are dealing with, we have to find that lifestyle that's actually causing it. We are the lifestyle that we live. So
exactly. So what are some of the examples of some of these things that might cause these problems to occur? So, the other couple of months ago we had ice, and I slipped and I fell and I landed absolutely flat on my hinder and then backwards like this. And I thought, this is the reason we have chiropractors. But you're saying maybe not so.
Well, that is true. Okay, so
Sure.
When we're talking about all these stresses, and as a chiropractor, and I even throw a fourth one, but we call them the 3 T's. There's 3 major stressors that we have within our health. It's your thoughts, traumas, and toxins, okay? And so obviously when you slip and fall, that's a trauma, okay? There's going to be some form of a whiplash or something that goes on that can cause vertebrae to shift and move, and then again, that can be putting pressure or putting interference onto those nerves that causes problem. The anatomy of a nerve, only 10% of a nerve is actually your sense of feeling, pain, okay? You only feel, it's only like where your pain, touch, those senses, only 10%. The other 90% is your motor function and your autonomic system. You don't think about your heart beating, your lungs breathing, your food digesting. You don't think about any of those things. They just happen. And so, is pain a part of chiropractic care? Well, it is, but it's a very small portion of it. Once the pain goes away, it just means that those nerve fibers going through that nerve are no longer being interfered with or problematic. But what is the motor function? What is the blood vessel control? What is these other things that are actually occurring through it? So likewise, obviously you're touching on traumas. Otherwise, in my office, my office sees a lot of pregnancy, pediatric, and overall family wellness. Okay, because when we're looking at this again, I'm seeing a lot of these conditions in our kids, and as a community, we're getting sicker and sicker, and we really want to go the other way. We want to be getting healthier. And so when I'm dealing with pregnancies and stuff, from conception, if you're having a stressful pregnancy, pregnancies are no longer a joyful occasion
They're
anymore.
complicated,
They
man.
can be complicated. There's a lot that's going on that can happen. But either way, it's more of like a diagnosis now than it is a joyful event. I mean, we're having a new life and getting to celebrate that. But then we go in and it's, what could go wrong? What could go wrong? Well, that adds stress, which also has the thought component of it too. Our mind is incredibly powerful. But my point to it though is that during the pregnancy, when patients come into my office, I can usually start and end a conversation through a health history at how their pregnancy was. They'll tell me a lot about what's going on with their kids. When you have stressful pregnancies, it leads to interventions. Interventions leads to complications, okay? Or I'm sorry, I said that backwards. Leads to complications, which leads to interventions.
Okay, right.
Okay? And so which then can lead to C-sections, okay? And, stats show that World Health Organization says that our cesarean rate should not be higher than 5 to 10%. But stats show us that at UW, just down the road, that almost 1/3 of every birth is via a C-section. Planned, yes, and that's another thing, planned.
Planned.
Right? So, our bodies are designed to be well. They're designed to go through a process like it's supposed to, but yet sometimes we feel that we know better than what our body or what this innate intelligence that actually runs us to thrive and be well, that we want to know what's better. So we do a planned C-section or these other things. Well, a C-section is incredibly stressful on a baby. I mean, the whole birth process alone is stressful, okay? I mean, again, I don't know the last time any of us tried to fit between an 8 to 10 centimeter hole and came out perfectly fine, but,
29 years ago for me.
Yeah, so, well, research again shows us that there's a medical doctor, Dr. Gutmann, who was actually in Germany, that actually researched undiagnosed birth trauma in kids, and found that over 80% of kids had some form of undiagnosed spinal trauma that went undiagnosed, and so that
from birth.
And
and maybe these kids are 10 now. Is that what you're saying, or are these?
So this was done in the 80s. So these kids are going to be in their late 20s, 30s.
Okay.
And so there's just. Yeah, so they're getting older now, stuff,
Yeah.
but either way, but you have undiagnosed spinal trauma. So what happens though is that these vertebrae will start to shift due to that trauma, okay? And where the perfect storm comes in is understanding a subluxation and the role that it plays throughout our health. And so in my office, I actually refer to them as the 4 Ds, okay? We have 3 T's, your thoughts, traumas, toxins that overwhelm a system, which leads to a subluxation, a misalignment of the spine. Essentially, a subluxation is like your spine is like a fuse box, okay? And so when you overwhelm a joint or this area of our body, the spine will actually rotate. It's just like your fuse box. Doop, shut it off. We're overwhelmed. This is bad. We'll shut it down. So what that leads to, though, is that once that joint actually shifts, it's called dyskinesia, or abnormal kinesia is movement. So you have an abnormal movement is really what that means. And so it's just like having a crooked hinge on a door. You lose that range of motion. And so that's, as a chiropractor, we go through range of motion tests and stuff because we want to see how things are actually moving, okay? So once we have abnormal movement, it has to lead to something. The next one is disafferentation. Disafferentation, dysfunctional afferentation input. You have a dysfunctional input, okay? And so what's really important out of this is that we have 5 senses. That's what we're always told, right? We have 5 senses, okay? But I'm going to sit here and tell you really have 6. So yeah, obviously sight, touch, smell, sight. But the last one that no one ever talks about, though, is proprioception. Okay, and proprioception essentially means movement, and so I can do a really fancy trick, right? I can take my finger, I can put it behind my back, I take my left hand, and I can bring it around, and I can grab my finger every single time. I know where that finger is in space, okay? So if we have an abnormal motion that has a decrease, which leads to an abnormal input, which is proprioception, that motion goes down, everything in life has to have balance. Something has to go up. And so that's called nociception. And nociception, essentially what it sounds like, it's noise. So a lot of times when we're looking at kids when they have, sleeping issues or, focus and memory, essentially when they're concentrating, all they have, it's like Metallica blasting in the back of their head, do-doom, 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 do-doom. Well, how well are you going to focus when you have this stuff going on?
It's hard, and that's kind of what we're talking about what you were talking about when you said the new normal. That these kinds of things have become so common.
Correct.
That we're looking at them as being normal. In dentistry right now, there's a tiny little kernel starting called Darwinian dentistry, and that is the study of how we came to where we are. And in the last 125 years in particular, the face has shrunk so much so that we don't have enough air, that we are suffocating, that kids won't sleep. If they can't sleep, they can't stay awake during the day, so they twitch and they squirm. And you're saying, too, that we're having these birth traumas. It's hard to get pregnant these days, and the birthing process has changed dramatically. They try, I think, to make it a little bit more home-like or homey or less clinical, but you still have all the beeping in the background, and you got wires attached to your baby, I think, still. So,
right, and if you have a baby that's hooked up, obviously the normal birth process itself is that, once we actually have this baby, they really should be on mom's chest. They need to be familiarized with that common heartbeat, that common physiology. I mean, there's a connection between mom and son, mom and daughter. I mean, right? There's always that connection that they have. And so, obviously, this new baby, this new life is in an unfamiliar situation. You need to keep them as calm as possible so that they can continue to develop and everything else. you know, so again, when we have too much stress, it can lead to a subluxation, which then can go to an abnormal motion to abnormal input. From there, we're going to have an abnormal autonomic system, so it's called dysautonomia. So, because if you put garbage in, you're going to get garbage out. And so, I mean, to relate this in another way for people is that if you want to see ADHD in an infant, it's called colic.
Oh.
Okay, I mean, it's an overwhelm of the system that things are going, okay? But if your baby is stressed out, so going into the autonomic nervous system here, there's two systems within it. You have your sympathetic system, which I always like cars, so that's your gas pedal mode, okay?
Okay.
That's your fight or flight response, right? If a bear jumps in here, all of a sudden, you and I are either gonna, right? We're either gonna fight it or we're gonna run away, right? And that system has to turn on. Well, after we either take care of the bear or get away from it, right? We need to heal and develop, and that's when our parasympathetic system becomes activated, or your brake pedals. That's where your rest, digest, and development mode is. And so for these kids, you need to be in that parasympathetic mode more often than the gas pedal mode, than that sympathetic fight or flight. And so what happens though is, again, when we have in dysautonomia, our body gets stuck in a constant fight or flight mode. It's a gas pedal that's just being slammed down. You're a Porsche flying down the freeway at 120 miles an hour, and then but when we're stuck there, so all of a sudden we see this 90-degree bank, so we get our kids to school, they're concentrating, they do fine, you get them on task, then all of a sudden it's time to go home, or you have to go to dinner. But all they have is a gas pedal, and so they're going to use these Trek bicycle brakes to try and slow this Porsche that's flying down the road. It's very, very difficult. And so when we look at kids with ADHD and all these things, there's just this explosion of energy, this explosion of unorganized information throughout their systems.
So you have we have a couple of graphics that show that. So the one that you're describing right now is the picture with the bull.
Yeah.
Some kind of,
I guess, no, that's okay. Yeah, so I don't like, okay, there's two things when I grew up. We don't call people names, and we don't do drugs, okay? And so it's really the same thing happens with diagnosis, okay? I understand there's an importance to diagnosis, but I really don't like to diagnose people. I mean,
it's a label.
Sorry. I don't like to label people, thank you. I still diagnose, but I do not like to label people. Because kids, they do realize that, oh, I have ADHD, I needed to have, this is how I feel. That is a emotional stress to them. And I'll tell you, I'm a type 1 diabetic that grew up in a very small town. I was the only diabetic, and I can tell you that that was a label, and people would treat and talk to me a little bit differently due to my diagnosis, my label. So in my office, I really don't like to give that to kids because it really helps with their mind. So when I see an ADHD kid, I refer to them as a raging bull, right? Because we see these kids, they're very erect, they're very stiff, and they're a little more, I want to use they're kind of high strong. And so, but isn't that kind of like a raging bull, right? We're just ready to go, right? But it's a fun term. Hey, you're just kind of a raging bull today, aren't you, buddy? You know? But yeah, on that graph though, so in my office, we can actually measure some of these energy levels that are being expected out. And so you can see from the graph here that obviously red and black is probably a bad thing. It is, okay? This is an explosion of energy, of muscle tone that exists around these children. I mean, how well are you going to react if every muscle in your body from head to toe is firing at an uncontrollable pattern rate? Well, that is someone whose gas pedal is being slammed down to the ground. They can't stop. They can't do absolutely, I mean, they're still going to grow and still be human, but that's why they have the behavioral issues that they do. They're distracted from absolutely everything. You know, and likewise, we can go to, your ADHD kids are going to be more high-strung. They're pretty going through that. Otherwise, you can go to ADD, where these kids are going to be a little bit more disorganized. They're going to have, they're not going to be as coordinated. They're going to be a little more sluggish with things. And again, we can measure that. And if you want to pull the next graph up there for us, what that shows is that actually...
Which bull?
So I refer to this as the drunken bull, right? Okay, because they still, they still got the energy and some of the emotional components of these disorders. However, you can see there's a yellow area in there. Yellow actually shows us that it's not working at all. So around the head and upper part of the back, we have this explosion of energy that's kind of uncontrollable, but we don't like it so much that we shut the other half of the body down. Well, so half is on and half is off. how well coordinated are we going to be?
Right.
There's a disorganization.
So how are you measuring, how are you getting those colors and numbers? Do you have like a little machine that goes down your back?
Sure. So it's called an inside subluxation station that we run, and so it uses thermography. It's a surface EMG, and it also uses a pulse wave profile. So we can actually measure. So I was talking about the different Ds of a subluxation, and we can actually measure each of those. We can measure the dysautonomy that's going on. We can check out the dyskinesia through through our palpation and range of motion tests. But it's able to measure the different functions of our nervous system to find out what actually is being interfered with.
Okay. Well, that's good. So it's partly your hands, your educated hands, and partly a machine, and you knowing how to read the output.
Correct. Correct.
Okay.
You know, and it's awesome because you can watch the body heal and change and doing things, and which is awesome. Rather than just
how do you
again,
feel?
just how do you feel? How do you feel? Well, now we've made it subjective. You know, people get better. They feel that's great. Well, people also feel great with high blood pressure and have a heart attack tomorrow. Did they feel that blood pressure? No, they didn't. Well, subluxation is the exact same way. Only 10% of it is sensory. The other 90% is asymptomatic. You have no idea it's physically present, but it's slowly taking you down without you actually knowing it.
Without knowing.
So
we have another bull. We have 3 bulls, right?
Oh, correct.
We have a raging one, we have a drunken one, and we have
the drunken raging bull.
Oh,
okay.
the drunken raging.
Yeah, so this is more of one we see in autism and a lot of sensory spectrum, where again it's a mix of both of these conditions where parts are on and parts are off. It's very, very disorganized. You know, the raging bull, when we're looking at it, the pattern exists. It keeps a pattern. It's just amplitude is just blown out of proportion. But yeah, so it's for different. Again, these scans again are not diagnosis. Okay, it just shows me how the body itself is functioning. So we need to know where the brakes essentially need to be applied to the body, if that makes more sense.
Well, it kind of does, and it's nice to be able to have a visualization of ADD or ADHD or pick your problem.
Or constipation.
Yeah, it's nice to be able to visualize that, and then, like you said, have a treatment and then, or a series of treatments, and then remeasure and see a comparison.
Correct.
It's a little bit more accurate, I would imagine, than having just an X-ray, because that takes a long time to show up on a film. Correct.
You know, and again, just going back and reiterating again, as a chiropractor, we do not treat constipation and do not treat any of these conditions, because it's all about rebalancing out the body and optimizing neurological flow. That's, you know, so I just like to make that point very straight, because like people are like, oh, ear infection, chiropractic. Well, yes, people come to us for these things, but knowing that our treatment does, you know, there's a lot of amazing testimonials.
Yeah, you go backwards and okay, now you're constipated, so that part of the neurological system is located over here.
Correct.
So let's see what happens when we...
Well, is there interference? And that's what we measure. If there's an interference pattern that exists in this part of the spine that the neurology feeds to the large intestine, small intestine, colon, if there is a problem there, hey, this might be a cause of this. You know, likewise, you have to look at the dietary side. What are you eating? You are what you eat. And so, you know, if we're eating out a lot, if we're eating processed foods, we're eating a lot of these other things, of course it's going to back us up. Our gut flora is terrible. You know, our gut is really, it's our second brain is really what it is. I mean, over 75% of your immune system actually lives in your gut. And so if we're eating processed foods and all these other things and not getting proper nutrients in there, yeah, it's going to be dysfunctional. So then again, the gut is going to do these things. The nervous system and those nerve roots are going to read that, and then subluxation, these misalignments of the spine, can then produce based off of what the soft tissues internally are actually, how they're actually functioning and coordinating.
So a lot of these things, from what you were saying, starts in infancy. When at birth, let's say.
That's fine.
So the birthing process, and I've done that a couple of times, is not something you have a lot of control over.
Correct. Correct.
And so I think we have a little picture of this too, with how the atlas bone, right?
Sure.
The one that holds the head up, right?
Yep.
That's where your head lands, and how that interacts with probably the biggest nerve, in the whole body, the vagus nerve, right?
Yep.
So when the baby's coming out, when the baby's being delivered, regardless of how fancy the doctor is who's on the other side there, or midwife or whoever all, the chances of that getting pinched are pretty high.
They're pretty high, and that's where that 80% of undiagnosed spinal trauma comes from, is actually this, what you're talking about here. So if you ever see a C-section, essentially what it is that we make an incision into mom, and we actually grab the head from under the head, and actually we use that atlas on the sides as a lever. And because we're biomechanically weak, we start to pull up. It actually applies 60 to 90 pounds of traction to the head and neck. Okay, so that's the same as me going and grabbing a 4th grader, grabbing by the head and going, ah, right? What is mom and dad gonna do? I'm running for the hills because they're chasing me, you know?
Yeah.
But we do this to introduce people to life. Well, anyways, so they grab right from here. And actually, what they do is, because biomechanically we get weak to this point, so naturally torque is going to help with more force. So we apply a torque, and so by grabbing that atlas, we twist. Okay, it's pretty similar to what adjustment looks like now, isn't it?
Yeah.
So either way, so most newborns that will find a subluxation typically on the right-handed side. Why? Because most people are right-handed. So the doctor is right-handed will actually cause that subluxation. But you touched on the vagus nerve. Yeah, your vagus nerve is your 10th cranial nerve. And vagus in Latin literally means wanderer. And that's literally what it does. It wanders our entire...
Everywhere.
Everywhere. It goes our entire GI system. It actually innervates every single major organ in our body except for our adrenals and our thyroid. Why? It's because those are both your gas pedal hormones or organs. So it's a brake pedal dominant nerve. Okay, so if we're going to bring it up and then we twist it, it puts pressure on that vagus nerve, which is a brake pedal parasympathetic dominant nerve that talks to our gut, which is our second brain. So it causes all these different neurological issues. And so, kids, they're picky eaters. There's all constipation, doing a lot of these different things. A lot of it can become because of that vagus nerve is being interfered with. And so when that vagal tone is abnormal, your body's going to respond to that.
It's a crazy system. You can't just take it all apart. You can't just keep building all these silos and then having people go from silo to silo to silo in order to get help. We have to integrate more of these things because they don't all stand. Nothing stands alone.
Nothing stands alone. It's all about the lifestyle that you live and the choices that you make. My job as a chiropractor is to teach you about the 3 T's, okay, the thoughts, traumas, toxins, the major stressors that are actually existing in your life, and how you can manage those. While we're managing those, we're going to remove the subluxation, optimize neurological flow from brain to body, so everything that function restores and is working optimally. So I remove the interference while we make the other lifestyle changes. What are you eating? How are you exercising? Are we doing meditation or any form of anything to keep our body calm that's going to access that brake pedal parasympathetic system rather than sitting on the gas pedal because we're overworked, we're overtired, and everything else.
So do you do a lot of nutritional counseling then in your practice?
We touch on it. We will do nutritional counseling as well.
Do you have a nutritionist that works there too?
No. As a chiropractor, I have my nutrition certificate, and we work on it as need be. We will dive through those things. It's all a process. We need to clear neurology first before we. Anybody can go to that's never worked out in years. All of a sudden you go to the gym.
Yeah.
I mean, how long does that work, right? You have to piece by piece this stuff together so you don't overwhelm it. Because all of a sudden you're going to go from I've lived this lifestyle to bam, we're just going to change 100, do a 180. How likely is that to stick?
Yeah, you need to work with habits.
You have to work with habits, and so that's what we concentrate on. So yes, we will work with the diet and nutrition because it's all a part of the whole body and the whole person. So.
Awesome. So where can people find you?
Yeah, so I'm the owner and chiropractor of Elite Chiropractic, which is located at Prairie Lakes, which is over by Cabela's, Costco, and Marcus Theaters and in Sun Prairie here. So.
That's awesome. And then you have a website?
Yep, my website to check us out is sunprairiechiropractor.com. That's
pretty easy too, right?
Yeah, very easy.
Sunprairiechiropractor.com.
Pretty simple and easy. So.
Well, thank you so much for joining us again.
Thank you for having me.
Not for the first time. Let's say the first time, because I'd like to have you come back more and talk about some of these other aspects of chiropractic and how people can benefit from stopping by your office and achieving higher level of health. This
Absolutely.
is Shirley Kutkowski, the owner of Primal Air, OMT, and breathing retraining here in Sun Prairie on Main Street, and your host for the Spot for Health in Sun Prairie. Have a great rest of the day and share these episodes from ksun.tv.